Hi, and welcome to the Wellness Exchange. My name is Diana Salinas, and I'm the Hidalgo County Employee Wellness Program Coordinator. Today we spoke with Dr. Efrain Rodriguez, whose clinic is located in Alamo, Texas, with South Texas Health Systems. We spoke about obesity medicine and how small lifestyle changes can make an overall healthier impact in your life. We hope you enjoyed today's episode, and if you haven't already, make sure to like and subscribe to our YouTube channel. Thank you so much for joining us today.
Thank you for having me.
Yes. So we'll go ahead and get started. Can you go ahead and share some background information on obesity and the Rio Grande Valley in general?
Well, in general, obesity, like many conditions, has been increasing in prevalence. So that what that means is that a higher proportion of the population is getting to the obese classification. Especially in the Rio Grande Valley, it's been shown in the media that in the past years it's been among the top 10 cities in the U.S., sometimes top one, number one in obesity in the United States.
And so what would you say are some comorbidities or other illnesses that might accompany a diagnosis such as obesity?
Usually the ones we see the most is the metabolic syndrome, and within the metabolic syndrome is the diabetes, high blood pressure, high cholesterol, and when you have one, it's very likely that if you don't take care of yourself, you may get the second one and the third one. They sort of go together.
Right. Okay. And so that can definitely lead to other parts of the body as well, right? So like your heart, your lung, and all the lungs, your liver, right? All those other organs, important organs. What is a major component that you would say of treating obesity? Let's say like in your practice.
It may sound very simple, but lifestyle changes is the backbone of obesity treatment. Because even though if you get other kind of treatments, if you don't do the lifestyle changes, then it doesn't really work that well. And it also helps with the preventing the regain of weight after weight loss. Okay. So lifestyle changes from the very beginning to pretty much forever. Right? Yeah. It's not like a specific diet. It just changes that you can sustain throughout your life, mainly eating habits and exercise.
Yeah. Okay. So eating habits, exercise. Would you say that these kind of vary from men to women, or would you prescribe like a different type of regimen or those specific lifestyle changes for men and women specifically?
I think it's pretty similar. It's up to the patient or preference. Really, when you think about physical activity, if the man prefers some more physical, like MMA, boxing, versus women may prefer maybe some indoor cycling or Pilates, or people should make changes in habits according to their preference. When it comes to eating habits, I think everybody's different. Not everybody can sustain a 1,500 calorie diet per day. Some people may only do 1,800 or 2,000. So it depends on the goals of individual goals for them.
Okay. And so like, for example, for family members who want to begin that wellness journey together, like let's say they want to start going to the gym or maybe cooking at home or something, like that's, of course, it sounds like it would normally be highly recommended, but kind of for somebody who may be new to like getting started in that path, would that be something that you recommend as well?
Yes, I think if the whole family participates together, there's a support system between, let's say, parents and the children and husband and wife. If everybody's on the same page and everybody's committed to making the changes, it may make it easier if you, maybe not family, maybe friends. If you have a friend that goes to the gym with you, I think it makes the accountability better. It's better for the outcome.
Definitely. Awesome. Would you say that there are any like quick fixes to handling obesity? I know a lot of times we might want to go into like the newest diet, like you were saying, like there's no specific diet, but are there any, for those listening, just to kind of, I guess, make it known that it does kind of take a little while,
Yeah, weight loss is not quick or easy. I think the quickest would be a surgery. Not everybody is a candidate, but if they're a candidate and they perform surgery, I think that's going to give the quickest weight loss. But just to for goal setting, weight loss may be 1 to 2 pounds a week. So if you want to lose 100 pounds, it may take a year, it may take 2 years. So it's not something that you're going to achieve, overnight.
Right.
But yeah, there's different kind of surgeries, there's different kind of procedures, endoscopic through a camera, some instruments, balloons. But the main ones is the room-wide gastric bypass and the gastric sleeve.
Okay.
There's some medicines that may also help with weight loss.
Oh, okay. But even with those types of faster changes, they still would need to implement those lifestyle changes as well? Or would you say that it kind of takes that pressure off? Or?
No, it has to be combined with the lifestyle changes.
Yeah.
Like I said, if you have the surgery and you don't do the lifestyle changes, you're gonna regain the weight.
Right.
So it's just and it's also to have a healthier life, improve many other conditions, mental health, self-esteem. Just having some physical activity in the long term is going to help you, sustain that weight loss.
Right, definitely. Awesome. So for someone who's currently battling obesity, what sort of support systems do you commonly see? Do you notice that people who kind of partner up with like-minded individuals who kind of have those same goals in mind tend to do better? Or let's say like somebody who kind of is on their own path and they really have that mindset of, I'm going to make this change for myself and I can do it by myself. I know that, of course, everyone's different and everyone has those different paths, but does it really make a big difference as to like what type of support system you surround yourself with?
Yes, I think if somebody's struggling, if they've been struggling throughout life, if they've been losing and gaining again, I think one of the most important aspects is going to see a professional, maybe a family doctor, an obesity doctor. There's different team members. There's counselors, psychologists, dietitians. It's a whole team. When talking about the community, I think family, friends, being part of the community, people with the same goal is going to, make it more comfortable for the person to lose weight and be part of a group.
What would an average visit with an obesity or doctor of obesity medicine look like? Can you kind of walk us through a normal day in your clinic?
Yeah, well, it's at the beginning it's pretty much the same. It's taking vitals, taking the weight, the height, calculating the BMI, the body mass index. That pretty much tells us if you're classified as normal weight, underweight, overweight, obese. During the visit, the main most important thing is getting a good history, like for how long you've had obesity and you have struggled with weight. An important aspect of the history is the mental health component.
Oh, yeah.
Because it may affect self-esteem, like I said, body image dissatisfaction, depression, and anxiety, family history, and in the history, eating habits and exercise. That's the main component. Other than that, we check labs. We check for thyroid, we check for diabetes, cholesterol. So that may be before or after the visit. And then we may also take some measurements, like your waist, your neck, check for sleep apnea, things like that.
Oh, that's true. Yeah, sleep apnea. I know that's kind of a common symptom as well, correct?
Yeah.
Awesome. Okay, great. Yeah, that definitely has its similar components of a normal doctor's visit. And I think the fact that y'all add in that mental health component really, I think, is going to make it that biggest difference in the long run to increase a person's self-esteem and their self-efficacy as well, to be able to really make sure that you feel like you can make that change yourself, right? So that's awesome. So most of our employees do work, normal 8 to 5 jobs. Some are sitting at a desk most of the day. Some of them are outside working most of the day. But how would you kind of generally start to maybe suggest having a better work-life balance for those individuals? So, and specifically talking about, being able to incorporate physical activity and healthier eating habits as well.
I think together with the patient, we should come up with smart goals, realistic goals. If I tell somebody to do something, if it's my idea, it may not be as good as if it's coming from the patient.
Right.
So we sort of have a good conversation and then commit to maybe 2 to 3 goals during the visit. Maybe simple, maybe decreasing the amount of tortillas or bread. Instead of eating 4, maybe cutting back to 2. So like eating less quantity, substituting for other things, or eliminating certain foods. Instead of, like I said, instead of drinking 1 liter of soda, maybe having 1 can every other day. So start making those little changes.
Right.
So how to start? I think to stick with the routine and the changes, we should start with small goals, like I said. Instead of committing to going from no exercise to I want to exercise every day for an hour.
Right.
Maybe more realistic and for the long term, to start like 30 minutes Monday, Wednesday, Friday. Maybe with the family, maybe taking a break, a lunch break, start meal prepping. So it depends. There's a lot of things you can do. So just at the end, I think sticking with 2 or 3 every time and then moving forward is the key.
Yeah, that's awesome. Yeah, because you don't want to make a 180 lifestyle change and not be able to maintain that, right? So I did want to ask this question. So like, what do you like most about your specialty in medicine?
I like the obesity medicine aspect. I think I like chronic conditions like the diabetes, the cholesterol, the hypertension, and making the lifestyle changes really. In order to prevent condition, the preventive aspect is to me what I enjoy also the most. So we do pretty much everything in family medicine. We do the cancer screening, the immunizations, we deal with mental health, we deal with acute visits, the infections, the cough. So I think the variety makes it fun. You don't get bored with doing the same thing every single day.
Awesome, awesome. And I guess just kind of before we wrap up the interview, is there any other information or advice that you would want to share with our employees?
I think the main point of weight loss and lifestyle changes is creating the habits. Deciding to start and going back to the values is going to help them stick with the plan and making the correct choices. So going back and thinking, why do you want to lose weight? If it's because you want to be healthy or have less pain or spend time with family, I think the value system is going to help them stick with the plan.
Excellent. Awesome. Well, thank you so much for joining us here today, Dr. Rodriguez. We really appreciated having you. If you haven't already, please make sure to like and subscribe to the Wellness Exchange and to our YouTube channel. And we hope you enjoyed today's video.
Thank you.